Let me tell you, there's a big difference between what we did and what President Obama is doing. What we did, I think, is the ultimate conservative plan. We said people have to take responsibility for getting insurance if they can afford it, or paying their own way. No more free riders.
And you can look at my positions. Many of my positions, I believe, are very conservative. All of them, frankly. I know some people say, gee, your Massachusetts health care plan isn't conservative. I say, oh, yes, it is. Because right now, in this country, people that don't have health insurance go to the hospital if they get a serious illness, and they get treated for free by government. My plan says, no, they can't do that. No more free riders. People have to take personal responsibility. I consider it a conservative plan. So what's my view? I'm a conservative through and through.
The Romney system has mandates in Massachusetts, although you've backed away from mandates on a national basis.
No, I like mandates. The mandates work.
Beg
your
pardon?
Let me
know you were going to admit that.
No, absolutely.
You like mandates.
Let me tell you what kind of mandates I like, Fred, which is this. If
the ones you come up with.
Here's my view. If somebody can afford insurance and decides not to buy it, and then they get sick, they ought to pay their own way, as opposed to expect government to pay their way. And that's an American principle. That's a principle of personal responsibility. So I said this: if you can afford to buy insurance, then buy it. You don't have to if you don't want to buy it, but then you got to put enough money aside that you can pay your own way. Because what we're not going to do is say, as we saw more and more people in this country doing,
you impose tax penalties in Massachusetts.
Yeah, we say, look,
buy it.
If people can afford to buy it, either buy the insurance or pay your own way. Don't be free riders and pass on the cost of your health care to everybody else.
All right, what has Massachusetts done? And as I understand, the plan is that every individual has to buy health insurance if their company doesn't provide it. And if they're too poor, the state will give it to them or will help them buy it, correct?
That's a pretty fair statement. What we've found is that if you have people who sit outside the system and instead just show up at the hospital when they're sick and expect someone else to pay, that's a free rider system. It's bad health care for them. It's expensive for everyone else. Now we're saying, everybody come on in. We want you to buy insurance if you can afford it, and we also will help you buy insurance if you can't afford it. We look at your income, and of course we subsidize those at very low income.